Hello and good morning. Good morning. This is Dr. Yonette with another episode of Baby Talk. And I want to lay off a little bit of the raising the child who is over responsive to sensory stimuli and go to the opposite. Because if there's an over, there has to be an under. So if you're noticing in your child that he or she is under responsive to sensory information or input or stimuli, here are some things, one, that you would need to look for to determine what category your child falls in, and then two, what are some of the strategies that you can use. And I want to encourage you that if you feel out of it and a little bit confused, that you seek out help from a professional, an occupational therapist. You talk with your child's pediatrician so that he can direct you. You can talk with your child's teacher as well, so you can get the help you need. So, what do we mean? What do we mean when we say a child is under responsive to sensory stimuli? Let's talk about that a little bit. So this is the kind of child that moves around his or her world with this reduced awareness to sensory stimuli that's coming in at different points. The vestibular, the gustatory, the tactile, the auditory, and the child seems totally unresponsive. The child also will be less responsive to touch input, to sound, to movement, to visual information as compared to his peers or to her peers. So what are some other areas that we need to focus on with this child who is under responsive? You know, the house can be burning down and that child is just sitting there and totally unaware of what is happening around him or her. The child who is unmotivated, I shouldn't say is, appears, because a lot of times teachers and parents believe that the child is like totally lazy or unmotivated, but this is not the case. The child really is having a low response to sensory input that's coming in, and so it will take a lot more to get this child up and going. So the child is unmotivated or appears to be unmotivated, has difficulty with engaging with others, seems lazy and sometimes clumsy and uncoordinated. And you will also notice that this child tends to be floppy and have low tone. Okay, low tone in the muscles. He's just flopping. The body is flopping down. He's never sitting up straight and tall. He is like all over the place. All right. So what are some other behaviors that you would expect to see from this child? The child will fatigue easily. He has or she has low endurance to activity. The child has challenges with completing tasks. He starts something and it never gets done, or it gets done halfway. The child has toileting accidents, because again, the child is not feeling that input, that sensation that says you need to go to the bathroom, and he or she waits until they have an accident. The child is rumpled or twisted. They wear their clothing backwards. And I'm sure you have seen children like these. They appear at school and their clothings are on backward, or their the pants is twisted upside and the belt is in another place, and he or she thinks he's ready for school and well dressed. The child may also be a very messy eater and overstuffs his mouth. So look for those cues. You know, your child is stuffing his mouth. He or she's not feeling that the food is already there, and so he has to push more in to get the sensation so that he can go ahead and eat. And then you may have that child who is also drooling. So the drool is coming down his or her mouth, and they're not even aware that there's a lot of fluid in the mouth, and then it's drooling, it's falling down on the side of the mouth. This is also the child you would find with food left on their mouths after they have eaten, and they're not cueing in that there is something there. All right? So here are some guidelines to use. Here are some considerations to use when you are dealing with your child if he or she is under responsive to sensory input. Number one, you want to be aware that this child will need to be alerted and aroused. You have to use strategies to alert the child and arouse the child so that he or she is attending to the activity that is being done. Number two, you want to do activities that are fast and rhythmic. Okay, so you're moving him out of that comfort zone to kind of wake up the system. So you're pulling him down the hallway on a scooter board, and you're changing directions quickly so that the child system is alerting. You don't want to give it that consistent, I said rhythmic, it's supposed to be arrhythmic. You don't want to give the child a consistent rhythmic pattern that he's so used to that puts him in that lull. You want to change up things. Then you want to target. You were targeting here the trunk, flexion of the trunk, and extension of the proximal joints. Okay, so the trunk, you want to make sure that you're flexing in that area and the joints are extending, because when you extend those joints, it's going to require extra energy or input or alertness to keep them in that position. And then you want to increase, give a lot of stimulation to the systems, because this child needs more information to come in, because what is coming in, even though it's normal and what everybody else gets, this child is not responding enough. She's not, or he is not feeling that input. So you got to give them a lot more to increase that awareness and to get him or her functional. So let's look at the visual system. How do we help to arouse or to alert the under-responsive child's visual system? These are the behaviors that you're going to find in this child. And I want to go back to what I've been saying earlier about journaling. If you have been journaling regarding your baby, your child, you would notice where there are certain needs, and these should be alerting for you so that you can get the care that your baby needs. Okay, so the child is going to have challenges with finding items in his or her backpack or in the drawer. Stop a minute and notice if this is one of the behaviors that your child is demonstrating. You know, this is from a visual perspective. Is the child seeing what's in his environment? You send him to get his shoes or his socks from the drawer, and the child, I can't find it. Now, the visual system is not alerting enough for the child to focus on what he or she needs. And then the child may have difficulties with reading challenges in this child that is under responsive. Then you also notice in terms of eye-hand coordination, the child may have difficulties coordinating his hand and his eyes to produce any activity that will require that. It might be a ball game. It might be doing fine motor activities where coordination is necessary. The child will suffer in this area. And then you will notice the child is also messy and disorganized, and that will show up in his workspace, in his room, and on his desk, in his work area. Now, The visual system activities that you can use to help a child that is having these difficulties are these. Remember, we all come with needs, and it's not about labeling the child. It's about identifying what the child needs and providing the strategies so that the child has a better quality of life and the child can be successful. So you want to rule out first, to make sure, take your child to the ophthalmologist, do an eye exam, make sure that the vision is fine. And so you rule out that there are visual acuity issues or perceptual problems. And it's so that you can focus in and know for sure that the child is having an under responsiveness to visual stimuli. You want to separate compartments for materials. So you put the red socks here and the blue socks here and the green socks there. So you separate things out. You know, you put the crayons one side and the markers one side so that the child is able to easily see what he or she needs. You want to increase the visual contrast. Okay, if you're giving the child some paper and pencil work to do, increase the visual contrast. Use red pencils or red color pencils or green color pencils. Children with autism gravitate to green a lot. So you use green color pencils on white paper. So they're seeing the vast difference. It's easy for the system to cue in because you're giving it a hyper infusion of visual input. And then you want to provide visual boundaries to help the child with spatial awareness. You know, put a green line or a red line, or, you know, so that the child knows green is time to go and red is time to stop. You know, give the child those boundaries because he or she may appear as though they're deliberately disregarding your directions, your instructions, but it's a matter rather of him or her having a low or under responsiveness to what is coming into him visually. We'll talk again about the other systems, how the other systems are affected when the child has a low response to visual input. And I want to continue to encourage you to look for ways to significantly help your child as he or she is developing. Don't just let the child be. Don't just say, okay, I feed him, I bathe him, I dress him, and he or she should be fine. Give him that extra bit of information, of support, of whatever he or she may need so that they can be successful in society. Remember, the first step in getting your child to where he or she needs to be is to get yourself to where you need to be. Parents of children who are educated, who are knowledgeable, I want to say, and I'm not just saying education in terms of book education, who are knowledgeable, who know where to go and find information to help them with their child, have more successful children. So children of parents who love themselves and take care of themselves would end up being copies of what they see. So love on yourself, take care of you so that you can give your child the best options in life as they grow and develop. This is Dr. Yonette thanking you for joining me this morning and wishing you a happy beginning of the new week as you step out there and do your thing and help raise the next generation of successful children.